Good morning from Madurai. So today we're going to look at a word triage, T-R-I-A-G-E. Triage. So what is its significance in relationship to this corona outbreak today? Triage in French means to sort out. So what are we sorting out here? So we are sorting out the patients. So on the one side you have the patients coming, and on the other side you have your resources. So the main resources you have your materials, you have your manpower, trained manpower, and you have your money. These are the resources we have. So when this number of patients come and you have this number of resources, matching is not a problem. And when you have this number of patients and this number of resources, 1, 2, matching is not again a problem. So when you have this number of patients coming in, this number of resources, still you can manage. But when it is this number of patients and this number of resources, you have a problem here. And you have this number of patients and when you have these resources, the problem grows. So this is what that should not happen, and this is why everybody is trying to flatten the curve. Now, when you talk about this triage, there are generally 4 types. What is generally done in a peacetime, what is done in a wartime, and what is done during a nuclear explosion, and what is done during calamities like the COVID-19 outbreak. So during peacetime, say Grace Kenneth Foundation Hospital, we have a very simple triage method where we categorize the patients into a walking patient, a sitting patient, and a lying patient. When you look at the army, it's almost a similar thing which I adopted here. And army also, when a helicopter comes, you know how many to send, 1 or 2, and that is what it is about triage in the army. But when you look at a nuclear explosion, you can just imagine 3 places: people closest to the explosion, the next ring, and the outermost ring. The people closest to the explosion are more likely to succumb to the injuries very immediately, maybe within 48 hours. The second ring of people, they may die in 4 months or so, and only the third ring, the outer ring, they're going to survive. So when you're doing a triage in a nuclear accident or an incident, you're going to look at more people on the periphery than at the people inside. This is triage. So when you look at a COVID-19 like situation, like I've said, you have this number of patients coming and you have this number of resources, you have to match them. So when you match them, whether it is quarantine, whether it is testing, or it's treatment or discharge, we have limited resources, and the whole world has got only limited resources. So we are going to use them in an organized fashion, and this is called triage. So today we have learned a new word, triage. So far we've only been talking about flattening a curve, and I've told you what is the importance of triage in flattening these curves. And all the best, and bye-bye, see you again. Thank you.